Put the back of the hand right behind that knee there, bring it into flexion, and we're just gonna do a slight little push to get the movement. Hey guys, Dr. Mike and Liz here, Oak Brook Medical Group. We're gonna walk through a couple different ways that we can actually adjust the knees, right? So just like any other joint in the body, there's multiple ways we can adjust it, we can get things moving. Just kind of depends on the patient, how their pain tolerance is, how much pain they're in at that time, and what we're trying to accomplish. So let's run through 3 of them real quick. I'm gonna have Liz actually lay back for me. So all of the adjustments with the knee are always gonna be very light, right? It's, you know, some patients, bigger knees, smaller knees, but it's just a single joint. So we wanna be kind of comfortable with it. So the first one we're gonna do, I'm gonna block her toe, block her foot there. I'm just grabbing right behind that knee in the tibia, and we're just gonna do a light little pull right there. And then you also have the fibular joint. So the fibular head runs right here, comes all the way down into the ankle there. So a lot of times that little fibular head can move too. So depending on which way it goes, we're either gonna do a slight push with our thumb, or we can grasp behind it and we're gonna do a little pull. Again, it depends on what we're trying to accomplish. The other thing we can do is kind of create a fulcrum with our hand here. So we're gonna put the back of the hand right behind that knee there, bring it into flexion, and we're just gonna do a slight little push to get the movement that we're looking at for that knee joint. The last one that we're gonna do is probably the one that we use the most. It helps patients a lot, especially with the pain and then stability of the knee as well. So when we have patients coming in saying, look, I just feel like I'm walking and that knee gives out on me, this is definitely the one that we want to do. So I'm gonna have Liz flip over onto her stomach for me, please. All right, so then doing this adjustment, what we're gonna do is we're trying to find the back of that knee, the back of that tibia. So we're gonna adjust 2 spots, one on the inside, one on the outside. And this isn't one of those adjustments where you're gonna feel or hear a big pop, but all we're gonna do is put a little bit of pressure with that knee, and then we're just doing a little flip with our hand to get some motion in there. And then we're gonna move to the outside. Just 2 little flips, and that's a lot lighter than we would normally do with patients. But just wanna kind of show you how that goes, what that looks like, and the multiple things that we can do to help you guys get your knee pain under control.